Monday, everyone. In nursing, a lot of nurses and nurse practitioners are going into business. That's not the future of nursing. That is present day nursing. The future of nursing is that our curriculum and our policies, procedures, continuing education credits, requirements will catch up with us. If you're new here, welcome. My name is Dr. Kimberly Madison. I'm a doctorally prepared nurse practitioner, and I use social media to share my life, my journey as a nurse practitioner, entrepreneur. So every week I come on just to update you and share my life so it can be used as a case study at some point. And actually that aligns perfectly with what I just said. One day, nursing will be a standard core curriculum, either a requirement to get into nurse. It will likely be a requirement to get in. It may or may not, but certainly it will be part of the standardized curriculum once you are in. And maybe they'll use my story and the stories that you all share as examples of what not to do, what works, what doesn't, so on and so forth. So like I mentioned, all week on social media, we're going to have 2 topics today. We're going to talk about gender-affirming care and DNP project ideas. I have quite a list to share with you, and I'm not done. I still want to work on that list and share that with you soon. But if you're new here, I come on here weekly on the date and time has fluctuated over the course of the year that I've been coming on live on the weekend. Right now it's Sundays, 2 p.m. Central. If you don't know, I just moved, and I'm going to announce where I'm living next Sunday. But I want to give you all week long to put some guesses in the chat. If you already know, because I told you directly, don't participate. It's not fun. Or don't give the real answer. And then next week, we'll talk all about the location and why I relocated and what that's going to mean for our dermatology groups for NPs and PAs. So I'm still getting settled. So I don't know about this time slot. Maybe once my life gets back routine, this slot might work perfectly. But if I do what I did today, I went to church and then I went to some of my favorite places, then this won't work. And then I'll need to schedule it for later in the evening. But I think Sundays are good. Or Friday. I'm not sure. I think Sundays are best. So we'll stick with that. But normally I come on every weekend live at some time, and we talk about updates as it relates to health. So wellness, spirituality, mental health, physical health. In the new year, we'll start talking more about financial health. And then there's usually a topic. And now the topics are coming from you all because now you're messaging me and sharing your journeys and your questions and how I've touched you or inspired you. And that is encouraging. And it's very, it's funny because you're coming on here even now, right? I'm live and it's like, yeah, I want you to be here so we can talk back and forth. So it's going to be like an open office hours. That's my dream, is that I come on here at some set time once a week or once a month with a group of nurses at any level in their journey or education, and we can have like a back and forth. But I don't know, that it would probably have to be more like Zoom and then link it to YouTube. That would probably be the better format. This way you can, really talk back and not just me reading messages. But that's my ultimate dream with this channel. But in the meantime, this will suffice. But anyway, I come on and answer your questions, and now I actually have, like every week, it's a different question. But now I'm seeing some themes in the questions, and so that's one thing we do as graduate and doctorally prepared nurses is identify themes. And so this week, and when I think about the year, I've been hearing more and more from DNP students who are wanting to do their project around dermatology. And that just makes me so excited, because when I was in DNP school, I wasn't in love with derm yet. And so it wasn't even on my radar. And so to be able to have the opportunity to brainstorm with you or to mentor like I am right now with a student at Johns Hopkins is super exciting. So yeah, like I said, if you, like I said, on LinkedIn, which you should be following over there. If you have ideas and you want to just go back and forth with someone, or you want to brainstorm or whatever, you can certainly hit me up. We can talk about it. If you need an advisor, we can talk about that too. We're going to go over a bunch of ideas that I came up with today that came from you all. And then this week, the Journal of Drugs and Dermatology hosted a webinar. It's one of the many things that they that would consider being a benefit of subscribing to them, as you get notified of these opportunities. And it was on gender-affirming care. And like I mentioned during the week on all my platforms, that being part of that webinar inspired me to just come on and share resources that I actually have talked about on the Mahogany Dermatology blog, which is now 2 years old. And this week, our DNP Dermatology and PPA group turned 1 year old. And it was DNP week, and Friday, the 25th, was the 20th year anniversary of the DNP degree. So this is perfect that this conversation is going to center around the DNP degree. And I'm going to share more about that, my experience in that, and what topics that we cover, some of the papers and discussion posts that I wrote during that time, because we know that there's a lot of questions when it comes to the degree, both from you all who are interested or thinking about or being encouraged to get your DNP, or debating between the two. So you just want to know, yes, I'm decided and I want to know what to expect, or oh, I'm still on the fence. Is it really worth it? To our colleagues in medicine and also in the public, just to give a better glimpse into what that looks like. Because we have that dialogue with ourselves all the time. And it doesn't really help to preach to the choir. So I thought, oh, it might be nice to do that. And at least those words that I wrote and the time I spent putting them together can live somewhere, get a little more life instead of sitting in my digital files. So look forward to that. But yeah, so JDD, like I said, they offer some of my favorite journals. And at first you might think, oh, it's pharmacology, it's drugs, that's boring. But they have like some of the best articles that I've read. One, they offer a complimentary subscription for MPs and PAs. You do have to have an MPI before you can get access, and that will give you access to, I would say, about 90% of the articles are access that you can get access that way. There are a few, like a small percentage where they're not open access. You have to purchase them or have some other kind of membership, which I'm not sure the option is, but it still gives you access to a bulk of them. And surprisingly, they cover a lot when it comes to social media, a lot of skin of color. I'm really curious who's who's writing for them, because it's a lot of skin of color topics. And yeah, like the LGBTQ, the gender-affirming care. So there's articles, there's on-demand webinars. They do video abstracts, so you can watch, you can listen. And then they do these live webinars like we had this week. And they're pretty frequent. And they're super nice. When I make content and post them, they always respond. Sometimes they message me back and stuff like that. So I have nothing but positive things to say about them. So that whole webinar inspired me. So we'll share the resources that I've already put on the blog. And then after this is done, I'll update the description box with anything else that comes up or that I didn't include on the blog that I can think of. And then if you have things, please, please, please share them with me. So yeah, we have our 2 topics, and then we usually go through a little bit of health and wellness, because if you're in the business of caring for other people, I believe you should always make sure you're taking care of yourself. And I can't just tell you that, I want to demonstrate that. And so we'll jump into this. And then I also have some things to share too. So if you're new here, I usually read from a devotional that was created for healthcare clinicians. And last week it was still packed away. It's out now, but last week when I went to the Holy Bible app, it took us to, I end up using a devotional from here, and I liked it. And it was about this one in particular. Like, you can look, if you don't know, you can go to the Bible app and you can put in topics that you're interested in, particularly as it relates to whatever it is you want the devotional to cover. And so, or you can just go to their page and see what they have listed. And so when I did that, I saw one on anxiety, and I thought that would be perfect, because I've talked about anxiety all year. I think it's quite prevalent amongst those of us in the field, particularly if you're patient facing. But even I get that sense from my peers who are in academia too, that there's a lot of that. Not so much anxiety, I would say more frustration. They would have to really chime in on that. I'd be eager to hear your thoughts about the anxiety. But certainly it's present if you still take care of patients. And it can wax and wane throughout your education, throughout your clinical rotation, and certainly when you're practicing, both at the bedside, especially when you're a new clinician. And then again, you feel a whole new level of that when you become a provider. But I'm happy to say it does get better over time. But anyway, I think this devotional is appropriate for us. So here we go. So this one is called Why Am I Anxious? Another important aspect of dealing with anxiety is recognizing the root cause of it. What is the source of your worry? What causes you to turn into a bundle of nerves at the smallest hint of a problem? While this varies from person to person, the biggest cause of anxiety for me was not being in control. What I mean by that is simply that I was not able to control the sequence or outcome of a situation. When I felt like the situation was slipping out of my control and was unfolding differently than I had envisioned, I started panicking. While I knew that worrying would not help the situation in any way, I still did it because my mind had been trained to fight, flight, or freeze instead of trust. Trust is a learned experience laced in faith. The Israelites, as we know, struggled all throughout their journey to the promised land. They worried, they complained, they grumbled. Was it because they lacked something? Absolutely not. God performed wondrous miracles in their midst every single day, thus taking care of all their needs and supernaturally providing for them. But because they chose to focus on their problems, worries, and compared their present reality to the positive aspect of their former lives in Egypt, their perspective was skewed. Instead of being grateful for the blessing of today, they were fearful about the uncertainty of tomorrow. They had to learn to trust in God's process and that His purpose was not to get them to the promised land in mere physicality, but mentally and spiritually as well. In the same way, learn to trust and lean on His process. Freedom from anxiety is at your fingertips, and He is your ever present help in trouble. And this is a reflection. Take some time out to identify the reasons for your anxiety. It may be unaddressed sin, a guilty conscience, feeling insufficient or insecure, a deep rooted or exaggerated fear, or as in my case, a sense of not being in control. If you're like me, you'll soon come to realize that not being in control may just be a blessing in disguise. While it took immense effort and a lot of time for me to hand the reins back to God, it was the most rewarding and liberating experience because the burden was no longer mine. Let's dig deep into your memory banks for a time as a child where you experienced anxiety and feelings of being overwhelmed. Now, in that scene, imagine Jesus walking in. How is he responding to your stress? In recent events, what has caused you to worry? What has caused you to lose your peace? Even on this day, how is Jesus responding to your stress? And I want to close with a scripture that I'm borrowing from the pastor today, and I think you're going to hear me say this one a lot because it really resonated with me, and it reflects my feelings for you all and allowing me to be a influence in your life. Anyway, which is I thank my God upon my remembrance of you. So every time I think of you, I thank God. That comes from Philippians chapter 1, verse 3. I thank you all so much. I was thinking about my own little journey, and I have my notes here, so that's why I'm looking down. Um, and how you can think something just starting, but if you look back over your life, you might realize like you've been dibble dabbling along the way. So like even when I think about this whole business thing, right, and entrepreneurship, I knew my maternal great grandmother that she had home, she had property, and she rented out some of the rooms, so house hacking, right, investment, and then she sold products and goods in the back of the house. So yeah, like so I knew that, right? But as a kid, I didn't connect that with entrepreneurship. Certainly now I do, and I wish we could talk about it. And then growing up, my paternal grandparents had a candy store. Again, didn't really have a concept of business, but still you got to think that exposure likely did something, right? And then when my dad was visiting, he told me that they too used to rent out space in their home. And so then I just thought like, wow, I really have a lineage of entrepreneurs. And so maybe it is in my blood, right? And then I was thinking back to this whole social media thing. Now it's called social media, right? There's a camera and there's me or there's you. But when I look back at being a kid, it started in the home. Everything started in the home or the family. So especially if you have kids or you're thinking about it, don't overlook your influence. So my dad would have a camera, like the big old kind, and we would just, me and my brother, especially me by myself, record myself all the time. I remember no. So now he's gonna do this the whole time because I was gone all morning. and he knows what to get my attention. Um, and so that's at home. Then in elementary school, which I forgot all about until today, that we had some kind of like school news, and I was in front and behind the camera because I saw a lady at church today running the camera, and I guess it triggered that memory. And so we used to learn how to work the camera, but also be in the front of the camera. So doing the news, the weather. So it's like, yeah, then that was elementary school. In high school, me and my high school friends, we would record ourselves, make skits up, and then convince our teachers in school to play them. And sometimes we would shout people out in the classroom during the skit. We would tie it to a lesson we learned that week to make it easier for the teacher to agree. And then if I had class in the morning, but my friend had class in the afternoon, we would convince the teacher to play it twice. And then in college, we go to the library and rent the big, bulky camcorder. Yeah, I think camcorder. You put a VHS tape in there, and that was for free. So I could rent that thing out for the whole semester. No one else ever requested it, and I would just go around campus and take memories of my friends and stuff like that. And so then you fast forward to this, and so that I was talking to Anthony Young on Friday. And we were recording for his episode today on hospice and palliative care on the Melanin Initiative. He's a new MP. He's making that transition, and it's like I actually had something to share, right? Because now I have experience I could impart to him. And we talk about imposter syndrome. And so sometimes if you look back over what you've already done, it can remind you like you're not new to this, right? Or you're new, you're still learning, you're still on the journey, but you don't need to discount the contributions and experience that you do bring to the table. So that's that part. And then church. I think church is actually a great platform for flexing your leadership and entrepreneurial ideas and like taking an ideation to creation. It's a great place because you have infrastructure there to support you in terms of people, finances, experience, and feedback. So I think it's important when we talk about burnout, which is one of the reasons we're going to stick with this anxiety devotional, is finding that balance. And so certainly in professional organizations, you can find it because it gives you a place where you can see your voice makes a difference, right? And maybe you're not doing anything patient related or clinical. Maybe you're helping with, programming and design or social media or marketing or finance, different either things you do all the time and absolutely love but want to do in a different way, or things that you don't do but you really want to spend more time doing it. That's a great place to either share your talents or develop them. And while I talk about certain nursing organizations, you can be in any organization. You're going to be able to get that fulfillment and that support and camaraderie. And the church is another place where you can absolutely get that kind of balance in your life. So I'm just putting that out there. And then before we jump into the DNP Project, so because this is Entrepreneur Series, so I talked to a lot of friends who have started businesses or want to start a business. And of course, I listen to a lot of people in business talk, and specifically the elite. So I listen to a lot of people talking on different platforms, but specifically when it comes to nurse practitioner entrepreneurs, the elite NP, I don't know if Barbara, she runs another page that's really popular that I've written about before on the blog, the Ohio Dermatology blog. She's been writing longer than Justin, actually. I want to say since 2008, and she has a private Facebook page, and I want to say she's authored a couple books, and actually she does have a podcast too. And I kind of forgot about her podcast. I need to look back. I need to read that. I need to tune back into that one. But she covers a bunch of different topics, and I'll put that in the link in the description box when it comes to business. And it's just great to have both perspectives. But yeah, by talking to them. So anyway, I was talking to a friend of mine a couple of days ago, and she was talking about she's been in practice business. She's been in practice, I want to say almost 20 years, but she's been in practice, her own practice for 1 year. So happy anniversary to her. And she was just talking about this sense of being overwhelmed, which of course I can relate to. I talk about that all year. Well, not all year, this first 6 months. But I can certainly relate to that sense and hearing other people talk about it, right? Anyway, so she mentioned all the challenges of all the roles that you have to fulfill when you're going to open your own business. So not only, which I've talked about before when we talked about the 4 quadrants, um, the cash flow quadrant by Robert Kiyosaki, is, you move from just doing the one role, clocking out, going home, to doing all the roles. So marketing, finances, branding, customer service, the clinician directly, taking care of the employees, HR, all those kind of things. And so you work 7 days a week, right? And so she was just talking about how the rooms that she's in, she's getting that same feedback from other people. And while publicly they might say, make it try to look everything as perfect, when you talk to them one-on-one, they actually admit their sense of feeling overwhelmed and things like that. So I asked her if she thought that was just the nature of the job or if there were any themes she could identify. And she thinks it's part of the job. But at the same time, she also felt that it was totally worth it and that the feedback she's getting from her patients makes it worth it. And that she's so happy to be able to deliver the care that she wants, to spend the amount of time with each patient that she wants. And it was reassuring too, right? And it just reminded me of this whole idea of being an MP, but also reminded me of being a runner and the whole idea of a marathon, right? And so there's a bunch of you all who want to be MPs, and it's challenging, right? Even being a nurse is tough. And when you hear that, it doesn't mean you shouldn't do it. You shouldn't run for the race. What it means is it's going to be long. You're going to sweat. You might get in some pain. You might hit the wall. You're going to be tired. There's going to be challenges. There's going to be this big wall ahead. There's going to be the unknown components of the weather. But you take that information, you just prepare for it, right? You put the right people in place, you pack your bag, you bring your water, you get the right shoes, you break them in way before race day, you don't try anything new, you follow all the recommendations, and you go out there and you run your race. And what I learned when I used to run the long distance races a lot is it's not, and this parallels imposter syndrome, which I was talking about with that new MP, right? So you say, okay, so I graduate. So first of all, you've been in practice for however long, you graduated, you passed all your tests, you passed your boards, you got your certification, you're now interviewing for jobs because you meet the criteria that require you to be a nurse practitioner, right? And yet you still struggle with this idea of, am I the one? And in running in a race, the day of the race is just a celebration of all the hard work you did to get here. Because most people who run races, they run that distance, if not more or close to it, before race day. That's part of the training. So when you run that day and it says finisher, you've been a finisher. You were a winner. Every day you woke up, every day you put your shoes on, every day you push past your own fears and doubts and feeling tired. You've been the winner. You've been the finisher long before race day, long before you take care of your 1,000th patient. You have been the nurse or the nurse practitioner or the entrepreneur just because you've been doing the same thing and you keep putting one foot in front of the other. Shout out to Dean Cardenas, author of The Ultra Marathon Man, one of my top 5 favorite books. I was going to say something about boundaries, but I don't remember what it was. Because I talked to y'all about boundaries. Yeah, I don't remember. Maybe I'll come back to me for next week. But last week I gave you a tip. I always try to cover like social media tip, and we talked business too, right? So we'll talk about LinkedIn real quick. But first, let me finish last week when I talked about how I communicate with my mentee. Another app that we love is Marco Polo, because at first she would give email updates. One of my mentees when we first started, she was brand new to nursing school. Now she's about to graduate. She just got a job offer on Friday. Shout out to her. She'll be in the NICU. She wants to be a neonatal MP. So you can just imagine how thrilled she is. And I'm so excited for this phase in her journey. Still have a couple weeks to go before the semester is over. But yeah, so happy for her and proud too. Not because she's got the job, but because she stayed true to herself and she remained faithful and she utilized all her resources. She was very transparent about the journey. Yeah. So yeah, with Marco, so she used to send me email updates. Then when her schedule got much more busier, then it was more like text. We would schedule video chats. And then eventually I went to Marco Polo, because you have unlimited time to make the video and you don't have to touch anything. So I remember videos of her like doing her hair and talking to me. And so that gave me a chance to get like a more glimpse of her personality. And of course, it just makes it easier to share, to message back and forth. So that's another tip. Of course, I have the Your Nurse and Nurse Practitioner Mentorship Match ebook in the Virtual Preceptor Shop, which is the name of my Etsy store. And that book is designed for both the mentor and the mentee, because you can make an assumption, oh, I've been practicing for X amount of decades. I know how to mentor, but that's just like saying I've dated before. I know how to date the next person. It's always going to be about the two people involved in that relationship. And you're always going to have to start from scratch with that relationship to identify who are they, what do they need, how can you help them, and how are we going to execute on that? When are we going to evaluate if this is working, and what are we going to do about the results that we see? And so, a big thing I know a lot of mentees need help with is communicating. And so, a big portion of the ebook is questions to make them be introspective and think about what it is they're doing, why they're doing it, put it actual into words. When Dr. Danielle McCamey came on the podcast 2 weeks ago, she mentioned that, right? She's open to networking and talking to people, and I can agree to that. But once you get that opportunity, it's knowing how to take advantage of it, right? Even Anthony talked about having that 30-second pitch together, right? With edge nurses, we don't really have a lot of experience doing that in terms of business, but certainly we've done it with patients, right? Your shift's over, or you have to go run and give a medication, or you hear the bed alarm going off, so you know you have to leave, and you know how to, or you have maybe a patient, maybe safety is a concern, or delirium or dementia or sundowning or something, where you have to get your point across swiftly, right? So you have done it before. You don't realize all the places it can be done. So um, forgot what I was even saying about that. Oh, so yeah, so the book is there for mentees and mentors. So you can either go over one question at a time. I think it's 13 questions in there. So you could use, say you meet once a month. Each month you can use those questions as a starting point and then get into like what's been going on. Or they can fill it out completely from the beginning, and then that can help you kind of devise, how you're going to move forward. It identifies the actual needs of the student at the bachelor's, master's, and doctoral level. But it doesn't have to only be for students, but that's in there. And yeah, it can be great for both parties, like I said. So for LinkedIn, your tip for this week was I can't remember if I mentioned the QR code on LinkedIn. So I talked already about going on there and just having a LinkedIn page, how to put your banner up, a professional photo, your name, quick little summary under your name about what you want to be associated with. You can link schools. Some people link their jobs. You don't have to do any of that. In your about section, what you're done, what you're doing, what you aspire to do. But the other great thing on there is there's a QR code. So when you do go out to events and people want to stay in contact with you, you can use that code. So you don't have to use a special app or anything. I use the Blink app, which I've talked about before, and there's a hi hello one, but the LinkedIn one is great too. And when you do it, you scan the other person's phone right there at the event. Let's say it's our upcoming Friendsgiving. And right there immediately say, hey, it was great meeting you at the Friendsgiving. Uh, can't wait to see you next month at the Ugly Sweater contest. Oh, it was great seeing you at Friendsgiving. Looking forward to our video chat in 2 weeks. I've already scheduled it. Oh, it was great meeting you at Friendsgiving. Thanks so much for being willing to help my student find a preceptor. Oh, it was great to meet you at Friendsgiving. I look forward to chatting further about how we can collaborate for upcoming publication on gender-affirming care. So don't just take someone's number, leave it, and don't assume they're going to remember you, right? So that's your way of sending a message to help them connect you with where you met. And the one thing the Blink app does, which you kind of have to guide people through, and you can do it when they accept your information, is there's a place for them to say where you met. And so when they fill it out, they can do that. But a lot of times when people accept it, and I get an email that they've accepted it, and I will import their contact information into mine, I can put that where we met too. So it can go both ways. Okay, let's jump into the ideas for DNP projects. So a very common one that I hear from all of you is, and there's nothing wrong with it, is improving screening for melanoma. There are more than some research sources say 4,000 diagnoses in dermatology. Melanoma is very important. It is a super, super important topic. But it's not the only one. And maybe it's not your favorite one. And there's a lot of other ones that impact the public. So let's get into them. So there's 4 types of DNP projects. And I just put this, oh, you know what? I just wrote an article on the blog and I talked about this. QI, or quality improvement, that's like the most popular one. I think because it's the most familiar. It's one I did also. But you can do policy. And the other 2 I can never remember. But I think I just wrote about it because I released 2 articles, one on our Derm and PPA group, and then this one too. Actually, you know what? Instead of looking on there, let me just ask the internet. And if you're watching this and you've already done your DMP project and it was derm related, let us know in the comments. Okay, translate research into practice. Huh. Okay, so let's do quality improvement. So quality improvement is focused on improving care processes and patient outcomes. So mine was antibiotic stewardship and asymptomatic bacteriuria in older adults residing in long-term care at the end of a life. And so the Agency for Healthcare Research and Quality, actually, they're a great resource because, the whole idea with the DNP project, so with the PhD nurses, they generate new knowledge, something we didn't know. Then that was taking like 17 years to make it to the actual patient care. If we learn that photodynamic therapy can be really beneficial for certain skin diseases in 2024, but then it wasn't making its way to the patient for another 17 years, that's insufficient. So people decided, okay, let's advance the education and training of nurses so we can help to close that gap. So we already have the information, but nobody knows about it, or they don't know how does that information apply to me, right? So at the DNP level, what we do is we translate that information. Okay, you've got this light. It can be beneficial for people with skin disorders. How does that work for this clinic, this hospital, this community resource? So then based on my understanding of the literature, reading a bunch of literature, in terms of cost, how it works, effectiveness, who's a good candidate for it, negative side effects, what it takes to actually bring it into a facility, all those things. Then I come into the setting that it's going to be applied because maybe the recommendations for putting it in a clinic versus a hospital are different. And then I help that staff, the whole staff or the whole system, implement that into their practice. So that's one example of how that could be done. Quality improvement is focusing on improving care processes and outcomes. So in my case, we have a patient who has altered mental status or infection. I don't want to say, let's say altered mental status and odor in the urine. Automatically, or they're at a certain age, they're confused. Automatically, people collect urine sample, and maybe daughter says, "Oh, every time she gets like this, it's always a urinary tract infection. They give her antibiotics, she always gets better." Well, we know that antibiotics don't come without any risk. So anyway, there are tools out there that you can follow to help support antibiotic stewardship. But if you're just going to clinic every day, home clinic, there's stuff that exists out here that you just don't know about. And so you have someone come in and say, hey, here's this thing. This is how it can work. This is how it can be implemented. And while there might be a tool and maybe has 10 steps, as someone who's in clinical practice can say this isn't feasible for this setting, they don't have someone who can implement the 10 steps, but we can cater it to fit here. So that's another way that quality improvement project can be implemented, and you can translate evidence into practice. You have implement and evaluate evidence-based practice guidelines. So this is use research to assess the effectiveness of practice guidelines, which I have some examples today that we'll get into. And then, of course, analyze policy. So And yeah, you can just Google and see a bunch of so other types of DNP project include designing and using databases to retrieve information, conducting financial analyses. I love that one. Designing and evaluating new models of care, leading collaborative projects, collaborating with researchers, especially PhD nurses. And there's the TRAIN program. Shout out to Dr. Kimberly Souffrant at Mount Sinai in New York. That's exactly what they're doing. And to Dr. Danielle McCaney, because she came up with a collaborative group that does that, just that, get DNP and PhD nurses together. Collaborating on legislative change. We're going to talk about that today. Working with coalitions to develop health programs. That's also on our list. And evaluating a new practice model, guideline, or innovation. I have that one here too. So those are the 4 types. So let's go over my ideas. So one of the easiest ones that a lot of people do, because you have to think about, a lot of people automatically think about the patient. They want to evaluate patient data. But if patients are involved in your study, that means you're going to need IRB approval. And IRB is a board that ensures safety of the patient, confidentiality of their information, those kind of things. And so there's different levels of IRB approval. There's the full gamut, which can take months, which a lot of times DNP students don't have. It can take, you can have an expedited version. I think there's like 3 levels of IRB. So that maybe you need the full thing, maybe you just need a little thing, and maybe you need an expedited version, or you don't need it at all. And so when people are trying to avoid IRB, and a lot of times you'll be pushed in that guided gently to try to avoid it, just for your own sake. Because the whole idea is just that you can demonstrate these principles, not that you have to, and that you execute them, not that you actually have to change the world within the course of your academic journey, but certainly that if you want to change the world, you will have the tools to do so after graduation, where you don't have any time limits or constraints. So the easiest one is pre and post knowledge. So you want to teach people about light therapy, right? And so first you give them, let's say you give them 10 questions before they do your 1-hour webinar. So that can be in person or remote, which makes it very flexible. You can kind of work with any setting. Sometimes they'll steer you to work at where you work, because you'll have easy access to data. So that's something. Depending on you and where you work, you may or may not want to do that. Depending if your project's even related to where you work. So they do your 10 questions, they watch your webinar, and after the webinar, they take the same 10 questions again, and you compare the difference in their knowledge when it comes to photo light therapy, for example. But you can do this pre-post knowledge with any topic. The other one you can do, you can identify barriers to using dermoscopy. So this can be, so when you're doing a dermatology project, your target can be, it can be dermatology providers, it can be primary care, it can be legislators, parents, teachers. So think about that. So but when we're talking about dermoscopy specifically, you can have it go towards dermatology providers. What are barriers to them utilizing it? What are barriers to patients understanding? Or primary care. Certainly if it's not part of their toolkit that they normally pull from. And so you do the webinar, you talk to them, do a survey, and find out what would be a barrier to them using it. Of course, time is going to come up on that list. Lack of knowledge, lack of confidence, lack of resource. So you can identify those barriers. You're going to always look through the research, see what other people have identified to reduce those barriers, and then you're going to try to overcome those barriers. Barriers to using AI. That's a good one. And then barriers to teledermatology, both from the patient perspective, like access to broadband or knowing how to navigate, how to use that time efficiently, and also on the provider side. Are they old school and they're just not into it? Do they not like the quality? Do they feel like patients don't send quality images or pictures, or they get frustrated when the call drops? Like a number of things you can identify barriers to. Access to care. Again, we have teledermatology. You can address getting access. So helping maybe a community or a certain age group of the population, or people who identify as being technological, having a poor digital literacy, and how you can improve their digital literacy score so that then they'd be more apt to using Telederm. You can look at cost in terms of that. And certainly if you do this in a rural community, things like I mentioned, broadband might be an issue. And maybe it's just education. So patients know like they need to have good lighting, they need to be in a quiet space, they need to be in a they need to be in a private space. So those are things you can do. Hold on. And then you could partner with other organizations that already have initiatives. So we have the Melanoma Research Foundation. They have, okay, hold on. Okay, sorry about that. So they have curriculum that you can for schools K through 12, and you can pick one grade level and just implement their curriculum. So you can do it, or what's better is that you teach the teachers how to do it. So each year they can continue that on. And actually, a friend of mine, a classmate of mine, when I was in DNP school, she did something very similar with mental health first aid. And there's actually just like CPR, there's already like curriculum for that. So she partnered with her children's school in Hawaii and set up training for the teachers and gave them that teaching, which is like train the trainer, because you can have train yourself to do it, and then you can do train the trainer. So I think she implemented train the trainer program at that school, and it worked out really nicely for her. Then you have you can address disparities when it comes to skin cancer awareness as well as light protection. So when it comes to skin cancer, there's, melanoma is not the only one. Certainly it's the most dire, but there's so many levels of skin cancer awareness that we can teach the public. And I really like this idea of light protection, especially when it comes to skin of color and people who don't understand the benefits of wearing sunscreen all year long, indoor, outdoor. And so that's an area that I really want to address in the new year. So that's a project you can center on. And even not just, and so yeah, you can target the public, you can target clinicians. You can do antibiotic stewardship in dermatology. I heard somewhere that dermatologists prescribe the most antibiotics, right? You could do the same thing with steroids, right? Steroid stewardship, and also increasing the confidence in primary care providers to use high dose steroids, topical steroids, and knowing how to evaluate the length of duration that should be and how to avoid the negative side effects of them. You can also do a lot of education is needed when it comes to the utilization of oral steroids in primary care and when it's not appropriate. So that's an area you can address too. But you want to always take these ideas to the systems level. What policy and procedures do they have in place, or standard operating procedures? So maybe you have 3 providers at this clinic. Do they all do the same thing the same way? So it could be antibiotics, it could be steroids. I have on here different procedures, biopsies. So you can kind of standardize care or identify which one gets the best outcome compared to the literature. So those are some ideas. My favorite one of my favorites, is going and speaking to or partnering with barbers, cosmetologists, and estheticians. One, they already don't get skin of color education. I know that. So that's an area you can address. You can pick anything, right? Skin cancer, hair loss, acne. You can talk to them about what they see all the time that they wish they had more information on. Particularly when it does come to skin of color, there's a whole list of you can even Google it, common dermatological diseases that affect skin of color. They can address that. Whatever community they're in, right? They can address those concerns. And then so in nursing, there's especially a lot of DNP students in primary care who do their DNP project in the barbershop. So they might be increasing awareness about certain primary care risk factors and also mental health. And so what I love about all 3 of these is that they already have an established presence in the community, because what you need is a setting. Okay, they already have a setting. You need someone who's going to agree. They're probably going to agree because you're going to help out their clients, which is something they want to do, right? You're going to give them the knowledge to be a greater service, because even though they're coming in for haircuts and their nails and all those kind of things, just like us, we become the social worker, the counselor, the extended family member, and so they become that too for their clients, and so they care for them and they want to learn more. Hair loss, yeah, even for with the barber, and especially all the and not just hair loss itself, but all the treatment options that are available, the cosmetic solutions that we have, and making it easier for them to have those conversations. And so, like I said, as a student who's the project lead over this, you need to have a setting. You need to be able to identify the stakeholders, have someone on at that setting agree to be the person on that side who helps kind of coordinate things and gives you your access to the setting and the community. And then they already have a people for you. So whether it's them and their staff, or them and their clients, or them, you, and the primary care MPs who are coming in, it's a great partnership, especially if you align with groups. Because I know, like at DNP Project, we have Dimensions in Nursing, and they partnered with a group that's already going out there and doing this kind of education in barbershops. And so they just partner with them and just make your life so much easier that way. But also it sets you up to create something that's sustainable, because they already have the structure in place. And that's what is different than maybe research that you've done prior to the doctoral level, is thinking on a systems level. And also, what can you put in place that's sustainable? National organizations and their strategic goals. So let's say you go to the National Psoriasis Foundation or the Rare Skin Diseases organization. I think so. There's the Alopecia Areata Foundation, Vitiligo. They all have foundations and they all have strategic goals. So you can just go to their website, see what it is that they're already trying to improve or advocate for, and you can just jump on board with that. So you don't have to reinvent the wheel, which so many of you, I'm sure, have heard your professors and advisors say. We've already talked about. So yeah, when you look at people, when you go and look at their policies, procedures, or standard operating procedures, you can compare that to the consensus statement that's already made available. So how are people addressing acne, maybe isotretinoin? Is it in line with the latest consensus statement by the American Association of Dermatology? That's one example. If you're in a hospital, you can move this even into wound care, right? You know that I'm on the advisory board at Children's Hospital, where they're establishing a nursing competencies for evaluating the hair and scalp. So you can do this too wherever you are, because this is in pediatrics in Washington, D.C. Their goal is to take it, nationwide, maybe globally at some point. But and by the time you watch this, maybe that's already happening. But certainly that whole idea, and you can partner with them too. They might be willing to make that connection with you. So that's another thing you can do when it comes to the scalp, but also when it comes to wounds, right? Maybe you're in a place where things like hair loss are low priorities. Certainly foot care is a great one, tied to diabetes and vascular diseases. But yeah, when it comes to wounds specifically, you can do how to assess it in skin of color. You can address their cost of care, the length of stay that's increased, the pain associated, the burden of disease on the patient, the family, and the staff. When it comes to assessing wounds in skin of color, it's not like education, it's the images people are being trained on. What access do they have to those images? There's medical illustrators. I talked about that one video who are working to create more skin of color images. There's the models that we train on. There's the cards that we put on our ID badge. So many ways you can address awareness of how to do those assessments. You can look at tools, decision support tools like Visual DX, and different apps that are available that help establish diagnosis or foster communication or improve speed of documentation, help with differentials, help with finding lower cost prescriptions for patients. You can explore that a lot there. Mental health assessments. Oh, also with those other tools, like there's tools to assess, um, to give scores, like for psoriasis and atopic dermatitis, um, all those kind of tools. Are they being utilized? And then how would it fit in the workflow? Is it a piece of paper that the provider fills out, the MA? Do you make it electronic? How can you help that facility adopt more electronic based tools and decision support tools into their practice? How can they implement AI into their practice more swiftly? What's available for that to happen? Who would be the people, the stakeholders, and the participants that would be overseeing that? And for some of those things, you might have to look at literature outside of derm to be able to get kind of identify solutions and strategies, as well as limitations and burdens to doing those kind of things. But then you just apply it to what you're trying to do. Yeah, the mental health assessments. Not when you think about how many patients are seen in a standard, dermatology care is provided in a lot of places, but a lot of times when we talk about it, we only talk about it like it's only happening in this private practice setting, but it's really happening in a lot of places. Um, and so when we talk about mental health, certainly there's some places where they're going to be able to address it more broadly, right? And do you create a whole clinic for it attached to your clinic? In one of these books I'm going to share with you before we close, she was a nurse at a clinic, and she noticed, maybe I can't remember if it was during her project or separate, not even related, that they had a lot of women who had been diagnosed with breast cancer. So she gathered a bunch of data to prove the necessity of starting a breast cancer clinic, brought it to the powers that be, and they agreed, based on the data, to help open up this clinic, which she now runs. And so she created her own job by doing that. And that's the main thing that you need to learn at this level, is how to get people's attention. It's always going to come down to the numbers. And also how you can, and so taking the same idea with the breast cancer, you can establish what's the bulk of the patients you're seeing. Like, we know hair loss visits take a long time, isotretinoin, right? And so maybe you create hidradenitis suppurativa, have entirely separate clinics within your practice, and how, what does that look like? What resources are needed? How will this improve outcomes and cost of care, access to care, those kind of things. Light therapy and vitiligo. So I had the fortune of talking to Tanja Johnson, who's the founder of Beautifully Unblemished, which is a support group. They're headquartered in Florida, but their reach is global. And she goes in front of politicians all the time trying to get rid of step therapy. We know that sometimes insurance will not cover the most effective treatment, as according to the literature, until patients have tried all these other things and failed them. And so she came on and talked about how when she talks to politicians, she's trying to get rid of that. And so you can be part of that campaign. You can collaborate with other specialty areas like oncology and palliative and hospice, find out what their initiatives are and how you can be of support there and help move that forward. You can address age groups. So certainly the different age groups, also pregnancy. Don't hear enough talk about pregnancy in dermatology, specific, likely because there's a lot of things that are not pregnancy safe, but then like, how do we still meet the patient's needs? How do we address that? Certainly LGBTQ, that's a whole area, gender-affirming care, making those conversations comfortable, creating inclusive environments. And then for ideas, so I spent the whole summer of my first semester in DNP school reading. I read like 50 different projects because I didn't know what I wanted to do. And sometimes you're not reading the whole paper. You start with the abstract. If you see enough things that pique your interest, I would usually jump to the methods section to see how they implemented it, if that was feasible for me. And of course the results, what came of this. And then what challenges did they have, and what were their recommendations for the future? Because you're the future. You can just pick up where they left off. So gender-affirming care, let me know if you have any questions about that. Gender-affirming care, inclusive environments. So I have a whole article on the Mahali Dermatology blog about how to create inclusive care environments, and I'll link that below. One of the key things is making sure the training that you're receiving, the training that you have access to, involves everyone from the front door who answers the phone, who greets your clients, to the back, the provider who's writing prescriptions, has access to this. The language that you use on your website, what's your digital presence? Are you letting the people who visit know that this is a safe environment for them? There's icons you can put on your website to let people know that this is a safe environment. Sometimes it's just putting on a flag. I wear a flag pin on my white coat. There's so many different ways you can adorn yourself. Like I said, your digital presence, the kind of clients that you showcase on your website, the literal words. We offer inclusive care. You can literally put the communities that you're open to seeing, the type of care you provide. Maybe you're using things like gender-affirming. So yeah, don't overlook your digital presence, as well as everything in the waiting room, including your staff. So the kind of materials you have, if you're playing anything on the screen, what are you putting there? And of course, the language, your consent forms, when you're asking to do pregnancy tests, instead of saying pregnancy, especially if you've already identified their preferred genders or preferred pronouns, instead of saying urine or breast, you can say things like chest, or instead of saying pregnancy test, you can say urine sample. Instead of saying breast, you can say chest. And what I loved about the webinar this week is I said, well, what if it is breast cancer? You also want to still be in alignment with the appropriate medical diagnoses. And so you just have a conversation with your patient and find out what makes them most comfortable. And that reminds me, even like people who wear binders, how increases their risk for truncal acne. Like, you could have fun with your project. You really could. And yeah, and building inclusive care environments, that's another way you can do in your project. And have that be like, yeah, so, and I'm close to an hour, so I'm trying to get the rest of this in. And then over the summer, well, during Pride Month, La Roche-Posay did like a online like party, and they partnered with OutCare, which is a website full of resources. They continue to have webinars all the time, but they have also a provider directory. You can add your name there, and so people in the community who know about the website can go there and see that you are a safe place to get care. Because so often the data shows that patients don't even, first of all, they wait till things are very advanced before they make an appointment, because of the kind of medical trauma they've experienced. Sometimes not intentionally, but it's by lack of knowledge. And so sometimes they might not ever make it back to see you as the provider because of the negative experience they've had with the front desk. And so it's really, really important to address that. And so when they see your name on this directory, it's going to be a little bit more reassuring that this is the place they want to go. And then they'll tell their friends that they can come here too. One of our members in the DNP Dermatology and PPA group, they joined that directory, and they're not sure if it's a coincidence, but not too long after that, they started seeing more patients, part of the community. And I just think it's great. We don't know, right? And I told them to ask so they can find out where they're coming from, right? I'm sure they would be more than happy to share that that's where they found them. And then there is the Fenway Institute in Boston. I might be messing up that name. And I want to say they are the first kind of established or entity that started providing LGBT population health. And they offer training for you as an individual, but they also will come in and train your whole team. And so I'll put them below too. And they have a directory also. So yeah, those are the resources. And so let me go over. Remember, you can, let me show you this book. I'll put these down below. This is called The Nurse's Guide to Innovation by nurses for nurses. And you know what? This is where I learned about Rebecca Place. If you don't know her, she's really into innovation. I'll link her YouTube, her TEDx talk on innovation in nursing. Innovation is what we do as entrepreneurs. We come up with ideas and solutions. So it might not be a word you've used before, felt comfortable, or even knew the definition. I didn't know before, but that's what you do every single day. And then Entrepreneurs by Janine Kelbach. And I've actually heard her give a interview. But this is 30 plus nurses turn into business owners and share their secrets to success. And so being an entrepreneur, and these are, well, this book is, you could do this yourself. Look how short, I might do this myself. I'm going to do this. This is such an easy one. Oh my gosh. And then I need to, I think she self-published this. Oh my gosh, you guys. So yeah, when we start the internship, that's going to be our project for next year. So she has 30 plus nurses. What number should we pick? Should we even pick a number? Just try to get as many as we can in here. NP business owners. Oh yeah, and she's in here herself too. She's a writer. So yeah, and then this week, Allie, our sister group advisor for Derm Ps and PAs of Atlanta, she made a couple posts about her experience becoming a member of Diversity in Dermatology, which is free membership, and the Dermatology Nurses Association. So shout out to Kylene Davis for helping us with that. But one of the benefits of joining, and as a student, it's free. A lot of your organizations are going to be free or low cost, is you get access to the journal. And the goal, which I shared with Kylene, is to get more nurse authored articles. Right now, there is a scarcity of nurses authoring in here. I actually just submitted a new article to the Focus member newsletter. It's an article I wrote on the blog last year, earlier this year, I can't remember. And so my goal is to be in every submission from here on out, and as well as this journal. So you heard it here, folks. And then last but not least, I did a nurse career fair, which is something you can do. You can partner with a health fair. Oh, so easy. That one's so fun. And the Sun Bus, that's another idea. I'm going to put all these ideas together for you so you don't have to take notes. I'll put all these ideas together for you to make it easier. But I made a career fair, and like I said, I don't do PowerPoints, I do workbooks so people can be more engaged and interactive, and then they have something that they can take with them that serves a purpose. Now this is a great reference for them to look back and remember, and it's a great gift if you know someone who's interested in nursing. Every time I think of you, I thank God. Thank you for watching. Thank you for letting me be part of your journey. I'm so glad that the journey that I've had, it has benefited me, right? But now that I get to meet so many of you and share with you on this global platform, it brings new meaning to those experiences. And I'm so grateful that it's a positive impact on your life too. I'll be on social media all week. The Mahogany Dermatology Nurse Internship application is live until December 15th. Friendsgiving, you can register until November 7th, and we'll see you on the 21st in Old Town Alexandria. We're looking to grow our group in Atlanta for Derm Ps and PAs of Atlanta. All the information for that is below. Yes, registration for Diversity in Dermatology is open. You can check out the agenda. If you want to meet me in person, that's a great place. I'll be there with my fascinator, and I'll meet you at Churchill Downs in Louisville, Kentucky, March 27th to the 30th at the Marriott downtown. And I met a new friend this week, and I'm looking forward to meeting her in person too. So kind. You guys have been so kind. So kind. I love this opportunity to make a difference in your life and for you to share so much and to be able to be in a space where I can be creative. You know, one of the guys I follow, he mentioned the people who get paid the most are the people who think. People who have time to think get paid the most. And when you think about the most labor-intensive jobs, they're often the people who get paid the least. So while it's so tempting to sign up for shift after shift and to work full-time and go to school full-time and build a family and build a business and do all those things at once because you can, like I said before, it's not the recommendation and it's certainly not the goal. And don't overlook the opportunity for solitude and peace and to allow your brain to be creative. The morning, there's a lot of research on allowing that opportunity in the morning of each day, but also in your schedule. Maybe it's once a day, once a week. I know a friend of mine, her husband takes the kids on Saturday so she can work on her business. One of my old mentors, she had her own practice. She basically ran it herself after she had to fire some people. And so she has a kiosk and everything's electronic. Before people wait in their car, there's no need for they sit in the waiting room. So, and she used to be in the Army. And so she timed it to the minute. After each appointment is done, she takes everything down, sets up the room for the next patient. They've already checked in. They come in, boom, boom, system. And every 6 weeks, she takes a break. She goes off. And I'm going to be adopting that. I'm going to continue my once a year sabbatical in August. These 2 weeks I've had off have been something I didn't know I needed, but I did. But yeah, I'm going to do that 6 weeks. At the podcast, we do quite a bit of that. Well, lately anyway, I changed, so now we don't film all month long anymore. We film a couple of weeks out the month, and we'll continue that too. But yeah, this whole idea of every 6 weeks. Stay tuned. I'm going to talk more about that. But in my own experience, I know it's beneficial. And when I listen to so many of my peers who are business owners, I know it's imperative. And so I encourage you to find time in your schedule to have time to think. And maybe in that time you're being creative, and maybe you're just being reflective or expressing gratitude, or maybe you're just there without an agenda. That might be nice too. Have a blessed week. Message me if you want. And I'll see you next time. Thank you so much for watching.